Well, good evening, Windsor residents, families, friends, and team members. This is Angie. This is your weekly COVID-19 video update, and today is Tuesday, September 1st, 2020. And today was a big day for us here at Windsor. We actually had our first reopening of a Windsor restaurant here at the community since, I believe, March 13th-ish. So it was a really big evening here at the community this evening. So we opened the Veranda restaurant. Many of you know that. You were there. It was not without its hiccups. I will say largely, though, we did have some rave reviews on food. We had a couple of misses. We had a handful of service challenges as we worked to get our rhythm back in the kitchen. But all in all, I do think it was a successful evening, and I look forward to being there with the Windsor team as we embark on another day back at it tomorrow in the Veranda restaurant. We are going to be tweaking the hours to the Veranda restaurant dining sooner than later. I believe we're actually looking at pushing hours back, meaning later dining times in the evening for the Veranda starting on Thursday. So club residents, Wednesday night, same reservation times unless we talked about it. Same reservation times as tonight as opening night. Tomorrow night, during your meal service, a member of the department head team will visit you at your table and get a new reservation time in place for you that will go into effect on Thursday evening. If you're not in the dining room, we will give you a call and schedule that with you, or of course figure out if you want to do delivery or carry out. Carry out is another area that we are going to be focusing on tweaking as well. To make sure that we can get our carry-out orders fulfilled timely and get those to residents at your preferred time so that you can enjoy those. So lots to learn from this evening. Had a very good night, though, with the team. Really great to have all that energy in the dining room, all the enthusiasm. Saw some wonderful food going out. I'm starving now after seeing all of that delicious food. So I hope that tomorrow night is even better than tonight. Hopefully we can work out some of those kinks and get things going a little bit more smoothly. But all in all, I think most people were just really glad to be out, be back in the Veranda with the hustle and bustle of their neighbors, hot food on a nice china plate. So we're going to call it a win, knowing that we've got some tweaking to do. Next up will be opening of the Ashby restaurant on Thursday. Those residents have their reservation times as well. Ashby dining will start a little earlier at 4 p.m. Your servers have worked with you on your specific reservation time. And we look forward to getting the Ashby open as well. But hopefully everybody enjoyed the new menu tonight again. We had some wins with the Ossobuco. Everyone who had that loved it. We had a lot of fillets go out. Yet we had some really great Tuscan turkey sandwiches go out and some burgers too. Chicken and waffles. I think everything on the menu was made tonight, so everyone got a chance to taste it. We're going to make some tweaks to the spaghetti pomodoro. Going to make sure we have our sides situated and everybody's aware because it's a new menu. So bear with us these first few nights. But all in all, I'm really looking forward to things as we move forward. So bon appetit. Saw a lot of empty plates, which is a beautiful thing. So thank you to all the residents, I have to say. I think we only had one situation tonight in the Veranda where someone didn't adhere to the COVID-19 restaurant etiquette, which is to be seated by a Windsor staff member. Resident kind of got tired of standing, so walked in and pulled up a chair. So we're trying to avoid that. But all in all, it was really a huge success. Masks were on. You know, everything. I mean, I'm really, really happy, which again, it's going to help us move more quickly through this process. The better that we can collectively execute this, both from a resident participation standpoint as well as a service standpoint, the better we are and the more likely we're going to get back to full service open hours in the restaurants. We just have to demonstrate that we can do it safely and get our desired result. So a huge thank you to all of the residents. And again, I think largely everybody had a good night and yeah, good things to come. Can you believe it is September 1st? And I think the day that's always burned in my brain is that March 13th. It was Friday the 13th. That was the first indicator of when things really changed. So almost 6 months. It's insane to think that. So it wasn't perfect, but man, it was good to see everybody or almost everybody out tonight in the veranda. I look forward to seeing the village residents on Thursday out and about too. So anyway, I'm really excited. You know, again, not perfect, but it just feels good to be back and have some more normalcy in our lives and to be able to see each other and chat with everybody. It was really wonderful. And a big kudos to our chef and Kel, our sous chef, and the food and beverage team, Shelby, and the servers who are all learning a new menu and getting to know their jobs under these new circumstances. Goodness gracious, they're wearing face shields and they're hot. But thank you all for being really good sports and making the best. So great night. All righty, let's move forward. PS Salon, as some of the residents have heard, unfortunately, I announced in Friday's notes, our stylist, Cynthia, decided not to return to Windsor. So PS Salon is working on identifying a replacement for her that will be a good fit for our community. So please stay tuned. We're going to continue to stay in contact with residents about appointments and let you know just as soon as we get a new stylist for our community. So I know it's a pain. I had a lot of really positive reviews on the performance in terms of your hair, etc. But unfortunately, so it goes sometimes in the world we live in today. Just a note, some people might have seen the press conference today with Governor DeSantis talking about visitations in senior living communities across the state. Generally speaking, my interpretation of that is that there's really no change as we have been doing essential caregiver visits or essential caregiver allowance into the community, people that are actually providing hands-on care to residents. As well as compassionate care visits for the duration so far of our COVID-19 situation we've been in. However, once that executive order is published and we have time to read it, digest it, if there are any changes, we will be sure to communicate it. But as of now, we're continuing with our drive-through visits. Please, 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 if you have a family member or you are a family member and you're in town, or, you know, we know that things happen outside of the Tuesday, Thursday visit times and hours. And we are really trying hard to accommodate things as they come up. Those one-off things where somebody's, you know, hasn't seen somebody for 20 years or only can do it at this time because of work. Please reach out to myself or Cece or David. We're really trying hard to accommodate those things. They're so important right now. So don't hesitate to ask. You know, the worst that we can say is no, we can't make it work, but let's ask, let's talk about it. Let's see if we can make it work. Okay. So visits continue as scheduled. Tuesdays for the club, Thursdays for the villages and the neighborhoods. And I had a resident today just tell us how wonderful their visit was today, and how good it is to see family, you know. And even if it's kind of the way we're doing it, it's just good to see each other. So next up, I want to thank everybody who came out and participated in our pup parade, whether you're a resident who watched, whether you're a family member or a friend who participated. It was a fun day. It was hot. And unfortunately, Of course, we did have a bit of a delay with the start because we did have a resident emergency and we did have 911 on campus. So we apologize for that delay. But again, all in all, another fun day. Lots of silliness to smile about, lots of family members, whether it was dogs for Joyce, America the Beagle Foal, getting to see Benji Holmes, Inga, our former resident Inga Holmes, dog Benji, who we all knew and loved. Just another great day, another great Saturday to be together and enjoy some fun. Continued good news is we currently remain COVID negative as a community. We had one positive in our last round of testing, which was, 2 weeks ago-ish now. However, per our protocol, we sent that employee for immediate follow-up of to do a nasal swab, and that person was found to be negative. They went 48 hours, repeated the nasal swab, and was also negative. So we pretty quickly turned that positive status into a negative status. So really pleased about that. In fact, that's been the case. We've had, in the last 2 rounds of tests of the last month, we had 2 employees, 1 each, and in both cases, both went for follow-up tests, nasal swabs, and got 2 negative nasal swabs consecutively. So that's good news. Next testing date, I believe, is going to be the 8th of September for us, and we do know that testing will continue at least twice in the month of September, and then at that point we will take additional guidance from Governor DeSantis and the Agency for Healthcare Administration in terms of how we will be testing our employees, if we will be testing our employees as we move forward into the fall. So more information to come on that, and of course, as is now, if we have any incidents of COVID-19, any potential confirmed cases, etc., I will continue to communicate those as those situations arise and evolve. So I guess from tomorrow is Wednesday, or today is Wednesday. If you're watching this on 2501, it's today. We have our Luau happy hour cart happening. So aloha, enjoy that. We're doing those on Wednesdays, of course. Flu clinic for our club residents. Please make sure, if you haven't already, you get your consent form over to Linda. I'm going to hold it up, and it might be backwards, but nonetheless, it looks like this. See, I started. I'm going to block out my age there. But it is the Walgreens Vaccine Administration Record Informed Consent for Vaccination. I got to finish filling mine out. We do our flu clinic every year for residents and staff. We absolutely encourage it. Goodness gracious, the last thing we need during the COVID-19 pandemic is a flu outbreak. Get your flu shot, okay? Club residents, get your forms to Linda. Ali and the nurses are working with the village residents and neighborhood families, friends, responsible parties. I have sent you the information via email to consent or decline. So please make sure you get that information back to Ali, David, or the neighborhood nurses. We want to make sure that everybody wants a flu shot gets it. Okay, and of course that's billed to Medicare or insurance directly by Walgreens for our residents. And for employees, it is something that Windsor bears the cost for, because we want to have a happy, healthy community of employees to provide our resident services. So please, employees, get your flu shot. We don't get it from the residents, they get it from us. So we want to make sure that we are doing that. Okay, let's see. Leftovers. We talked a lot about leftovers in the last week or so. As we have been cleaning residents, getting back into apartments, etc., we are seeing very full refrigerators. We're seeing a lot of food on counters, etc., and we are trying to help and intervene and get some of that cleaned out. Families, friends, residents, etc., as you talk to each other, please ask those questions. Let's make sure that we're disposing of any old food. You know, our village residents, 3 meals a day are kind of included in your monthly service fee. So we don't really need to be keeping leftovers for any length of time. Leftovers generally 3 to 4 days refrigerated, right? After that, everything needs to be disposed of. If you are having a little trouble and you need some help with disposing of leftover items, let your housekeeper know or let your server know, and we will help you do that. We don't want anybody eating any old food. There's all this fresh food. Don't eat anything that's been refrigerated for too long. So 3 to 4 days, okay? When in doubt, throw it out. All right. Circling back to COVID, just a general update. Again, we're negative. We're happy about that. We are, unfortunately, based on today's number, seeing a little bit of an uptick. 631,000 cases to date in the state of Florida. Today, 7,643 new cases, which is pretty significant, significantly higher than the last few days. We were down in the 2,000, 3,000, 4,000. So to see a 7,000 number, more than 7,500, I don't like that. It's not the right direction. With 187 deaths. So a total of 11,187. And I am going to quick, if I can get my crazy little mouse over here, I'm real quickly going to tell you the number of hospitalizations too, because that's what I've really been paying attention to. I've been trying to pay attention to the hospitalizations and the fatalities, because we do know that testing is so kind of here or there. We've had the last 2 positives we have were very quickly turned into negative. So was it that they were false positives? Maybe. I don't know. So that hospitalization number is interesting for me. Oh, wow. Yeah, that is the highest daily new infection rate since the 10th of August. So that's a big spike. So hopefully it's not a trend. It's just a one-off catch-up. Let's hope. All right. Hospitalizations, 38,859. Okay. So with almost 39,000 hospitalizations and about 11,500 deaths. Okay. So that's kind of what we're paying attention to. Still numbers we're not comfortable with that are high. But again, I applaud our residents and families and friends for just doing their best to follow the protocols and the precautions that we have in place. And again, as we move forward here and we try to loosen things and find a little bit more balance in our Windsor lives, we just have to maintain those good, solid prevention protocols, right? The masks, the social distancing, the good hand washing, and then not touching our hands and mouth, our eyes, nose, mouth with our hands. Those things go a long way. So nonetheless, that is where we are. Let's talk senior living real quick. Let's see where we are. Let's see. Oh, error reload. Here we go. Okay, the good news is I'm still seeing a trend downward of the senior living numbers, which is great news. Let's see where we are. 1,262, so 1,262 senior living communities. With COVID, I thought I had that. Oops, I'm just talking to myself. Which is right about where we've been. So pretty stable, not an increase, not a decrease, pretty stable, which is good. I mean, we got pretty high up there for a while. So this is definitely a continued step in the right direction. So very positive in terms of what we're seeing in senior living. We've talked about the kids went back to school a week ago-ish. So we're going to start to see if that's going to have any impact on the general numbers, the hospitalization, so on and so forth. We've also got a holiday coming up in Labor Day. So we hope that generally speaking as a state, we behave well and we keep those prevention protocols in place that we've been taught to date. And hopefully we can keep those numbers at bay and don't see a big, jump like we saw after Easter, after Mother's Day, after 4th of July. We kind of always see this little bump. So hopefully we've learned our lesson, Florida, and we can keep that under control. But I think that is going to be it for this evening. Let me just quickly peek through my notes here. Yep. So very excited to see everybody again tomorrow night in the veranda for our club residents, and looking forward to seeing our village residents starting Thursday night in the Ashby restaurant. Again, please bear with us for a few days while we work out all the kinks. We will be working on decreasing times for food to get to your table. I will say the good news is largely, even if it took a little longer than you'd like, it got to you hot and fresh and you could tell the difference, and that's important. So we will get there. So bear with us. We're going to try to keep a positive perspective and say, hey, we're just happy to be out among friends and neighbors and eating some delicious food. So everything else will fall into place. So that is going to be it for this evening. I thank you all so much. I look forward to seeing you around town, and everyone stay well.